Hi HPM 600, I am making a special ethics video for you today because I used to assign this textbook chapter from another textbook entirely, and people didn't really seem to click with it. It got bad reviews on the course evals, and I thought, okay, we can get rid of that. We don't need that. So what I'm going to do instead is kind of summarize it for you. Anyway, so that's the background as to why I'm doing a talking head video instead of giving you another resource, because I wanted to just tell you what I wanted you to know. First things first. I wish we had more time to cover ethics because they're so important in health and health policy. We're always making decisions about where we want to allocate our money, our time, our providers, and as you know, in health policy, it literally can be a matter of life and death. But as with any set of ethical principles, we use them to help us with situations where you can't do everything. You're in a gray area and you have to figure out what the best option is. Not necessarily what the one good option is, but what fulfills the most of the requirements we're looking for. So to answer that, we have to think of what those requirements are. And the point of naming and defining these is to assert what's important to us as a community, and then we make decisions accordingly. So there will be situations where well-intentioned people can examine these principles, they apply them to a situation, and they still come to different conclusions about what needs to be done. And that's okay, that's ethics for you. But when we have an established set of principles, at the very least we can be in agreement about how we're approaching the problem. Now, the same three principles are central in medical practice ethics and in public health ethics. They just take on a different focus. So as with medical care and public health generally, medicine is focusing on the individual, and public health is focusing on the population. So the three principles that we'll talk about that apply in both medical care and public health ethics are autonomy, beneficence, and justice. Autonomy is the ability to make your own decisions and exercise self-control. We also include privacy under here because it's part of the right to decide who has access to your information. Medical practice ethics prioritizes autonomy more than public health does. In public health, autonomy is not always the highest good. If you're making decisions, if you're exercising your autonomy, but the results of your decisions are harming other people, then public health might say, okay, autonomy is now subordinate to some of the other ethical principles. They outweigh autonomy here when we're deciding what to do. Medical practice ethics are less likely to do that because they are so individually oriented. An example of a situation in which autonomy is important is informed consent. People have the right to know the benefits and the harms of something before they agree to it. So for example, it would be wrong for a doctor to talk only about the good aspects of a procedure and not discuss what the complications might be if it doesn't go well. That would be taking away the patient's autonomy, their freedom of choice. Now, beneficence is about doing good. If you remember in medical practice, we say first do no harm. And it applies both in medical practice and in public health. First, do no harm. Help others meet their needs. On the medical practice level, beneficence is considered in terms of what is good for the individual. On the public health level, I know I keep saying this, beneficence has to do with societal level needs, not just an individual's needs. And if those are in conflict, public health will prioritize the group. An example of a situation in which beneficence is important is in research. So a research study might start out doing good in the form of finding out more about how a treatment works in a certain population. But if, as the study was going on, the researchers found out that the treatment was actually harming the patients, they'd need to shut the study down, even if it meant that their research was incomplete. Justice is about equality. That is, balancing the good and the bad so that no one person or one group of people is getting too much of either. People should have equal opportunities, they should have equal access, and they should benefit equally from what they receive. An example of a situation in which justice is important is in access to healthcare procedures and treatments. So if we're going to be just toward both our rural and our urban populations, we have to make policy decisions that will encourage providers to distribute themselves more evenly across the country. It basically violates the principle of justice for people to have worse access to healthcare just because of their geography. Same thing if they have worse access because of their race or ethnicity, because of their gender, because of their age, because of their documented or undocumented status. It's about equality. it probably would help to think of this justice more in terms of social justice than in terms of legal justice. So these principles all sound really good, but they can sometimes conflict with each other. So imagine that I'm doing a study and I'm recruiting people, and I notice that a lot of the people who are signing up for the treatment that I'm going to test on them, they're from a disadvantaged population. Maybe they don't have a lot of money, they don't have reliable jobs, things like that. So as a researcher, ethically, I have to ask myself, are they maybe signing up because they need the money or because they can't afford treatment otherwise? Now, that's not a problem in itself, but I have to think about the ethics. So beneficence could be prioritized if I let the study continue because we need new treatments and I'm doing good that way. I also don't want to violate their autonomy by not letting them sign up if they have an understanding of what the risks are. But I also have to consider the fact that the incentive could be leading to an unjust situation, because it would mean that one group was taking on an unfair share of the risks, and they weren't getting a commensurate boost in the amount of reward that they were getting. So I bring that up not because there's necessarily one answer as to how to resolve that, but I just wanted to walk you through thinking about a really simple little example and demonstrating how you can think about how these principles apply to lots of different situations. As a result, we can have these conversations transparently, we keep the key principles in mind, and then we can work toward a solution together that's well thought out and ethical.